Question 1. Forensic evidence collection and preservation. You are a forensic nurse involved in the collection of evidence from a suspected assault victim. The patient presents with multiple injuries, including abrasions, bruising, and what appears to be a defensive wound on the arm. The victim claims to have been assaulted with a blunt object. As part of your duties, you need to collect biological and trace evidence to support the investigation. Which of the following steps is most crucial to ensure the integrity of the evidence you collect? A. Collect all evidence in plastic bags to prevent contamination. B. Secure all evidence in separate containers, clearly labeling each item, and follow proper chain of custody procedures. C. Document the victim's injuries first and delay evidence collection until the victim is completely stable. D. Use standard gloves and clothing when handling biological evidence to minimize contamination. Answer. B. Secure all evidence in separate containers, clearly labeling each item, and follow proper chain of custody procedures. Explanation. The preservation of evidence is fundamental to the integrity of the forensic investigation. Ensuring that all evidence is collected separately and clearly labeled minimizes the risk of cross-contamination, which could undermine the evidence's reliability in court. Chain of custody is essential to document the handling. Evidence from collection to analysis and presentation in court. Incorrect answers. A. Collecting evidence in plastic bags can cause contamination, especially for biological evidence like semen or blood. It is critical to use breathable containers, such as paper, for biological samples to prevent degradation. C. Delaying evidence collection compromises the integrity of the evidence and may violate the patient's rights, potentially losing crucial for it evidence. D. Using standard gloves and clothing when handling biological evidence does not prevent contamination, especially if the gloves are not carefully changed between samples or the victim's injuries. Question 2. Sexual assault and abuse forensic examination. A 25-year-old female arrives at the emergency department reporting that she has been sexually assaulted. She is in a state of severe emotional distress. You are tasked with performing a forensic examination as a sexual assault nurse examiner, saying, which of the following should be your first priority in this situation? A. Complete a full body examination and document injuries in detail. B. Ensure the patient's safety and emotional well-being, providing trauma-informed care and support. C. Immediately collect biological evidence using sexual assault evidence collection kit, SEEK. D. Notify law enforcement and provide them with an immediate report of the assault. Answer. B. Ensure the patient's safety and emotional well-being, providing trauma-informed care and support. Explanation. The first priority when caring for sexual assault victim is to ensure their safety and provide trauma-informed care. Emotional distress can interfere with the victim's ability to participate in the forensic examination, so it is critical to address their psychological needs before proceeding. This approach helps to build trust and ensures the patient feels supported throughout the process. A full body examination should take place after the emotional needs are addressed, but focusing on the patient's psychological well-being is more immediate. C. Immediate evidence collection is important, but should not take place before the patient's emotional state has been managed and the patient consents to the examination. D. Notifying law enforcement is an important part of the protocol, but it is secondary to ensuring the immediate safety and emotional well-being of the patient. Question 3. Scenario-based. Death investigation and post-mortem nursing. Mr. Thompson, 62-year-old man, is found dead in his home under suspicious circumstances. There are no signs of forced entry and no weapons are visible. The body is still warm to the touch and there are no apparent signs of injury. The local authorities request that you assist with the preliminary post-mortem assessment. Based on the information you have, which of the following is the most likely next step in the investigation? A. Immediately conduct thorough physical examination of the body for signs of injury or foul play. B. Focus on collecting the surrounding environmental evidence, such as photographs and witness statements. C. Given the warmth of the body, presume natural causes and discontinue the investigation. D. Begin full autopsy to determine the cause of death without consulting law enforcement. Answer. B. Focus on collecting the surrounding environmental evidence, such as photographs and witness statements. The explanation. In the case of an unclear death with no visible injuries, a forensic nurse should prioritize collecting environmental evidence, including photographs of the scene, witness statements, and any other contextual details that could provide insight into the cause of death. This evidence is critical for law enforcement to investigate further. Body's warmth suggests that the time of death occurred recently, indicating that an investigation is still warranted. A thorough physical examination should be done, but first, the scene must be preserved and contextual evidence should be collected. C. Presuming natural causes is premature without conducting complete scene investigation. Many factors, such as poisoning or suffocation, may not be immediately visible. D. Conducting an autopsy should be handled by medical examiner or coroner and not the forensic nurse alone. The nurse's role is to assist with examination, but the final determination requires official procedures and consultation with law enforcement. Question 4. Forensic toxicology and substance-related cases. You are a forensic nurse in a hospital setting and a 19-year-old male is brought in after being found unconscious at a party. The patient was reportedly drinking alcohol but also took an unknown substance which his friends suspect could be a date-rape drug. Upon arrival, the patient is unresponsive but his vital signs are stable. As part of the medical team, you are tasked assisting in collecting the necessary forensic evidence and determining whether toxic substances played a role in his condition. Which of the following steps should be your immediate priority in handling this case? A. Obtain a urine sample for toxicology screening. Document the time of the suspected ingestion and preserve the sample under proper chain of custody procedures. B. Administer the antidote for the most common date rape drugs immediately to prevent long-term neurological damage. C. Perform a detailed physical examination to look for signs of physical assault or injury, as toxicology results are irrelevant at this point. D. Notify law enforcement immediately, as the substance is already confirmed and they will handle the investigation. Answer A. Obtain a urine sample for toxicology screening. Document the time of the suspected ingestion and preserve the sample under proper chain of custody procedures. Explanation. In suspected drug-facilitated crimes, such as those involving date-rape drugs, obtaining biological samples like urine as soon as possible is crucial for toxicology screening. Urine samples can help detect drugs that may not be easily traceable in blood. Time is critical because these substances may metabolize quickly, especially if the victim has already been unconscious for some time. Chain of custody ensures the evidence's integrity for legal purposes. B. Administering an antidote should only be done after identifying the specific substance and consulting with poison control or the medical team. C. A physical examination is essential but should not be prioritized over obtaining toxicology samples. If a substance-related event is suspected, D. Notifying law enforcement is important, but the immediate priority in a clinical setting is to secure toxicological evidence to understand the medical condition better. Question 5. Child forensic nursing and pediatric considerations. A 5-year-old girl is brought to the emergency room with multiple bruises, some of which are in varying stages of healing, and signs of physical neglect, including poor hygiene and malnourishment. The child's parents have conflicting explanations for her injuries. The physician suspects that the child might be victim of ongoing abuse, and you, as pediatric forensic nurse, are called to the child and collect evidence. Which of the following should you focus on first when approaching this case? A. Conduct full-body forensic examination, including head-to-toe inspection for any signs of injury or trauma. B. Immediately question the child about her injuries in private setting to obtain statement before other professionals arrive. C. Start with psychological assessment to determine if the child exhibits any signs of post-traumatic stress disorder (PTSD). D. Engage with the parents and obtain their version of events before conducting examination of the child. Answer A. Conduct a full-body forensic examination, including a head-to-toe inspection for any signs of injury or trauma. Explanation. In child abuse cases, a full-body forensic examination is necessary to document all injuries, including bruises, burns, and signs of neglect. The nurse should assess and document the physical evidence to help substantiate any claims of abuse or neglect. Given the varying stages of healing, the examination will help establish the history and progression of the injuries. B. Questioning the child should be done with care and by a professional trained in child forensic interviewing. It should not be the first step. C. A psychological assessment is important, but should follow the medical examination and documentation of injuries. D. Engaging with the parents might not be appropriate immediately, as their conflicting accounts may influence the disclosure and prevent an accurate understanding of the situation. Question 6. Legal and ethical aspects of forensic nursing. You are working as a forensic nurse in a clinical setting, and you receive a case involving a 30-year-old male who has been charged with assault. The patient has requested that you not report a specific injury to the authorities, claiming it was self-inflicted. In your capacity as a forensic nurse, what ethical and legal responsibility do you have in this case? A. Respect the patient's wishes and maintain confidentiality, as this is patient's right under HIPAA. B. Notify law enforcement immediately, as the injury could be evidence in criminal case. C. Document the injury in the medical record without reporting it to authorities, as the patient's consent is required for any disclosure. D. Maintain confidentiality until a court order is issued, then disclose the information as required by law. Answer: B. Notify law enforcement immediately, as the injury could be evidence in a criminal case. Explanation: as a forensic nurse, you have a dual responsibility to both the patient and the justice system. While patient confidentiality is essential under HIPAA, healthcare professionals are required by law to report injuries that suggest criminal activity such as assault to law enforcement. In this case, the injury may be crucial evidence. Investigation. A. Respecting confidentiality does not override the legal obligation to report suspected criminal activities, especially when dealing with forensic evidence. C. Documenting the injury without reporting it is inappropriate because forensic nurses are legally bound to report injuries that may have been caused by criminal activity. D. Waiting for a court order could delay necessary reporting. The nurse must act promptly to preserve evidence and protect victims' rights. Question 7. Death investigation and post-mortem nursing. During the death investigation, the body of a 72-year-old man is found in his home under unclear circumstances. The family reports that he had been in poor health but had no history of suicidal tendencies. There are no obvious signs of injury, and the body is cool to the touch. Based on these initial observations, what should be your first course of action as a forensic nurse involved? Post-mortem examination. A. Begin documenting the body's appearance and other factors such as rigor mortis and liver mortis. B. Assume that natural causes are responsible and notify the coroner's office to discontinue further investigation. C. Immediately take blood samples to test for any signs of poisoning or drug overdose. D. Preserve the scene and request the family's permission for an autopsy, as sudden unexplained death requires further investigation. Answer: D. Preserve the scene and request the family's permission for an autopsy, as sudden unexplained death requires further investigation. Explanation: sudden unexplained death should always be treated with suspicion until thorough investigation can confirm the cause. Preserving the scene and requesting an autopsy is necessary to determine the cause of death. An autopsy will help rule out foul play, identify underlying medical conditions, or detect toxins or causes of death that are not immediately apparent. A. Documenting rigor mortis and liver mortis is part of the process, but it should not be the first action. The scene must be preserved before any physical examination occurs. B. Assuming natural causes without an autopsy can lead to an incomplete investigation and possible misclassification of the cause of death. C. Testing for poisoning is one part of the investigation, but the first priority should be securing the scene and ensuring the body undergoes proper examination. Question 8. Forensic evidence collection and preservation. You are assisting with evidence collection in a case involving a suspected drug overdose. The patient is a 40-year-old male who was found unconscious and is now stable but unable to provide a clear history of the incident. You are tasked with collecting biological evidence for toxicology screening. Which of the following should be your first action? A. Collect blood and urine samples for toxicology analysis and preserve them using the correct chain of custody procedures. B. Focus on interviewing the patient's family and friends to gather any information about the substances the patient may have ingested. C. Immediately administer a dose of naloxone to reverse the effects of any potential opioid overdose. D. Conduct full physical examination and delay evidence collection until all injuries are documented. Answer A. Collect blood and urine samples for toxicology analysis and preserve them using the correct chain of custody procedures. Explanation: in suspected drug overdose cases, toxicology samples, especially blood and urine, must be collected as soon as possible to detect substances that may have caused the overdose. The timely collection and preservation of these samples following proper chain of custody protocols ensure that the evidence preserved for legal and medical purposes. B. Interviewing family and friends is helpful, but the first priority is to secure biological samples for immediate testing. C. Administering naloxone may be necessary in some cases, but it should not delay evidence collection, especially in a potential forensic case. D. A full physical examination is important but can follow the collection of the necessary forensic evidence. Question 9. Sexual assault and abuse forensic examination. A 22-year-old female arrives at the hospital after allegedly being sexually assaulted. She is physically distraught and visibly anxious. As a sexual assault nurse examiner saying, "You must begin the forensic examination. Which of the following should you prioritize during the initial phase of the exam?" A. Begin with the sexual assault evidence collection kit. Seek collecting all biological samples before speaking with the patient. B. Focus first on providing emotional support and ensuring that the patient feels safe, with the evidence collection following afterward. C. Take a detailed history of the assault and perform a full medical exam before beginning evidence collection. D. Immediately inform law enforcement of the patient's arrival before starting examination. Answer. B. Focus first on providing emotional support and ensuring that the patient feels safe, with the evidence collection following afterward. Explanation. In cases of sexual assault, emotional support is the first priority. Trauma-informed care is critical to ensure that the patient feels safe and supported before undergoing the forensic examination. Once the patient feels more comfortable and ready, evidence collection can proceed. Evidence collection is critical, but it should never take precedence over the patient's immediate emotional needs. C. Taking detailed history should occur after emotional support, but the first step is to stabilize the patient emotionally. D. Informing law enforcement is important, but it should not interrupt the patient care process or emotional support phase. Question 10. Documentation in forensic nursing. You are working as a forensic nurse in a hospital and have just completed an examination on a 30-year-old woman who has suffered significant bruising to her arms and neck. During your assessment, she is able to provide a clear history of the assault, describing how her partner repeatedly hit her. You are now tasked with documenting your findings. Which of the following should be your primary focus documenting this case? A. Focus on using objective medical language to document the injuries and signs of trauma in a clear and detailed manner. B. Write down the victim's exact statement of how the injuries occurred, as her testimony is critical for the case. C. Document any personal opinions or observations you may have regarding the victim's demeanor during the interview. D. Include summary of the assault based on your understanding of the situation, omitting the direct statements to avoid potential conflicts. Answer. A. Focus on using objective medical language to document the injuries and signs of trauma in a clear and detailed manner. Explanation. In forensic nursing, it is crucial to document findings in an objective and factual manner. Medical language should be precise without personal opinions or interpretations. This will ensure the documentation can be used effectively in a court of law. B. Documenting the victim's exact state. Important but should not overshadow objective medical documentation. Statements should be accurately recorded but should not be the sole focus. C. Personal opinions or observations should not be included in forensic documentation, as they could potentially affect the credibility of the case. D. A summary of the assault should not be based on the nurse's own understanding. It should reflect the victim's account as documented during the interview. Question 11. Trauma-informed care in forensic nursing. You are conducting an assessment on a 15-year-old girl who has been sexually assaulted. She is emotionally distraught and has difficulty talking about her experience. You are aware that the key to managing this situation is trauma-informed care. Which of the following approaches should you take to ensure that the patient receives the best care possible? A. Encourage the patient to speak as much as she feels comfortable with and explain the medical process in detail to ensure she understands. B. Provide a brief, factual explanation of the process and emphasize the importance of the physical examination as the most important part of the care. C. Focus only on the physical injuries and minimize discussions about the assault to avoid further emotional distress. D. Tell the patient that she must talk about details of the assault to proceed with the examination. Answer. A. Encourage the patient to speak as much as she feels comfortable with and explain the medical process in detail to ensure she understands the explanation. Trauma-informed care prioritizes creating a safe and supportive environment for the patient where their autonomy is respected. Encouraging the patient to speak at their own pace and explaining the process helps them feel more in control and less vulnerable during a difficult time. B. A factual explanation is not enough in cases involving trauma. The patient's emotional needs must also be addressed. C. Focusing only on physical injuries ignores the emotional aspect of the care, which is essential for holistic recovery. D. Forcing the patient to talk about the assault can cause re-traumatization and should never be done. Question 12. Chain of custody and forensic evidence. You are collecting evidence from a sexual assault case in which the patient is A 25-year-old female who has sustained injuries. You are responsible for collecting her clothes, hair samples, and fingernail scrapings. What is the most important factor to consider when handling and preserving the forensic evidence? A. Ensure that all evidence is clearly labeled with the patient's name and date of collection, and securely store it until it can be transferred to law enforcement. B. Immediately pass the evidence to law enforcement personnel before labeling to ensure proper handling. C. Collect all evidence without worrying about labeling, as the hospital's evidence storage system will take care of documentation. D. Store all collected evidence in general collection until law enforcement picks it up. Answer A. Ensure that all evidence is clearly labeled with the patient's name and date of collection, and securely store it until it can be transferred to law enforcement. Explanation. Chain of custody is critical in forensic nursing to ensure the integrity and admissibility of evidence in legal proceedings. Each item collected must be carefully labeled with identifying details such as the patient's name, date, and specific type of evidence to track its handling and avoid contamination or mishandling. B. Passing the evidence to law enforcement before labeling could lead to mistakes in tracking the evidence or misidentifying items. C. Failing to label evidence could create legal issues and prevent the proper handling of evidence. D. Storing evidence. General collection box is improper and could result in contamination or loss of evidence. Question 13. Managing victims of domestic violence. A 40-year-old woman arrives at the emergency department with broken ribs and lacerations to her face. She reports that she was involved in an altercation with her husband but is hesitant to provide details. She suspects that she may be a victim of domestic violence. How should you proceed to address her situation? A. Provide immediate medical care for her injuries and document the findings while also ensuring that she is offered information about support resources. B. Immediately notify law enforcement and the hospital social worker as the situation clearly indicates an act of domestic violence. C. Ask the woman for details of the altercation and press her for further information about her home life to gather evidence. D. Focus on stabilizing physical injuries and let her approach law enforcement if she chooses to do so later. Answer A. Provide immediate medical care for her injuries and document the findings while also ensuring that she is offered information about support resources. Explanation. In cases of domestic violence, providing immediate medical care is the first priority, along with careful documentation of injuries. The patient should also be given information about available resources, such as shelters, hotlines, and counseling services in a non-judgmental and supportive way. B. Immediately notifying law enforcement could be appropriate, but the patient's safety and privacy must come first. She should be given an opportunity to make decisions at her own pace. C. Pressing the victim for information could cause her distress or discourage her from seeking help. Supportive, non-invasive approach is recommended. D. Letting the patient approach law enforcement might not be enough to protect her if she feels pressure to stay in the situation. Question 14. Working with law enforcement in forensic cases. You are involved in a forensic nursing examination for a 50-year-old man who was found unconscious in his car with drug paraphernalia nearby. Law enforcement is present and asks you to provide them with any relevant findings from your examination. What is the correct course of action in this situation? A. Provide law enforcement with a summary of your findings without compromising patient confidentiality. B. Immediately disclose all your findings to law enforcement to assist with their investigation. C. Only share findings with law enforcement once a legal subpoena or court order has been issued. D. Share your findings with law enforcement, but make sure to explain that they cannot use your statements as evidence in court. Answer A. Provide law enforcement with a summary of your findings without compromising patient confidentiality. Explanation. While patient confidentiality is important, forensic nurses are also obligated to cooperate with law enforcement, especially when dealing with potential criminal activity. A summary of the findings may be provided without violating confidentiality as long as it is shared in an appropriate and legally permissible manner. Immediately disclosing findings could violate patient confidentiality and would not align with the ethical guidelines of forensic nursing. C. Waiting for a subpoena is not necessary unless the findings are required in court or law enforcement needs access to specific confidential information. D. Explaining findings as inadmissible evidence is not accurate. All findings should be documented appropriately for possible legal proceedings. Question 15. Death investigation protocol. A 60-year-old male is brought into the emergency department after being found dead in his home. The scene was not secured when he was transported, and no one has determined the cause of death yet. As a forensic nurse involved in the investigation, what should be your primary responsibility? A. Begin by collecting any biological evidence from the body to help determine the cause of death. B. Secure the scene and preserve the body for autopsy while coordinating with the medical examiner or coroner's office. C. Immediately inform the family about the cause of death, assuming it was due to natural causes. D. Focus on conducting physical examination to identify any potential signs of foul play before notifying the authorities. Answer: B. Secure the scene and preserve the body for autopsy while coordinating with the medical examiner or coroner's office. Explanation: in cases of sudden or unexplained death, preserving the scene and the body for an autopsy is crucial. Working with the coroner or medical examiner will ensure that the death is investigated thoroughly and that the cause of death is properly determined. Collecting biological evidence is important, but it should only be done after securing the scene and notifying the appropriate authorities. C. Informing the family is premature, as the cause of death must be confirmed through an investigation. D. Conducting physical examination should be done in coordination with authorities, but securing the scene and preserving evidence comes first. Question 16. Evidence handling and reporting in forensic nursing. You are working as a forensic nurse and have just completed a sexual assault examination on a 19-year-old female. The evidence collected includes swabs, clothing, and hair samples. What should you do next to ensure that the evidence is handled properly? A. Securely package and label all evidence, following the proper chain of custody procedures, and store it until law enforcement retrieves it. B. Wait for law enforcement to provide instructions on how to store the evidence and allow them to handle the packaging. C. Immediately hand over the evidence to law enforcement personnel without labeling or documenting the chain of custody. D. Store the evidence in a hospital locker until the patient what to do with it. Answer: A. Is securely package and label all evidence, following the proper chain of custody procedures, and store it until law enforcement retrieves it. Explanation: forensic nurses must handle evidence with great care to preserve its integrity for use in legal proceedings. Evidence should be securely packaged, labeled, and stored with clear documentation of the chain of custody. B. Waiting for law enforcement could result in evidence being mishandled or lost. Nurses must take responsibility for preserving evidence until it is transferred. C. Handing over evidence without proper documentation compromises the legal validity of the evidence. D. Storing evidence in a hospital locker is not secure enough, as it can be tampered with or lost. Question 17. Psychological first aid in forensic nursing. A 28-year-old woman is brought to the hospital following a violent mugging where she was struck with a blunt object. Although she has physical injuries, she is visibly shaken, anxious, and unable to talk about what happened. As a forensic nurse, what is your first priority in this case? A. Provide immediate medical care for the injuries and stabilize her physical condition before addressing psychological concerns. B. Begin psychological first aid to help her feel safe, grounded, and supported, creating a space where she can process the traumatic event. C. Ask the patient to describe the incident in detail to help her remember the facts of the situation. D. Focus solely on providing trauma care for her physical injuries and emotional needs only if she asks for it later. Answer: B. Begin psychological first aid to help her feel safe, grounded, and supported, creating a space where she can process the traumatic event. Explanation: psychological first aid focuses on providing immediate emotional support to help individuals cope with trauma. By ensuring the patient feels safe and supported, you can help them begin the process of recovery. A. Providing medical care first is important but should not overshadow the need to address emotional well-being. C. Asking the patient to describe the incident is premature and could lead to re-traumatization. D. Focusing solely on physical care without addressing emotional distress can exacerbate the psychological impact of the trauma. Question 18. Assessing injury patterns in forensic nursing. You are performing a forensic examination on a 40-year-old woman who presents with multiple injuries, including bruises on her arms, a laceration on her face, and a fracture of her collarbone. She tells you that she fell while walking down the stairs but appears overly anxious. As a forensic nurse, how should you approach this case? A. Document all the injuries and the patient's statement, but be careful not to challenge her story. Focus on physical care. B. Thoroughly document the injury patterns and compare them to common patterns seen in related injuries to assess their consistency. C. Immediately suspect that the injuries are a result of domestic violence, even though the patient has not explicitly stated this. D. Focus on treating the injuries without documenting pattern of bruises, as it may be too sensitive for the patient to discuss? Answer: B. Thoroughly document the injury patterns and compare them to common patterns seen in 4 related injuries to assess their consistency. Explanation: Forensic nurses must carefully assess injury patterns to determine whether they are consistent with the patient's story. In cases where the injury pattern is inconsistent with before, it is important to document the findings objectively without making assumptions. Documenting the injuries is important, but challenging the story should only occur once inconsistencies are identified. C. Suspecting domestic violence should only be done with clear evidence or when the patient discloses it. D. Not documenting the injury pattern could hinder any investigation, and it is vital to collect all evidence carefully. Question 19. Ethical considerations in forensic nursing. A 16-year-old boy has been admitted to the emergency department with a head injury and multiple bruises. During the examination, he reveals that he has been physically abused by his father. He is reluctant to involve law enforcement as he fears retaliation. As a forensic nurse, what is your ethical responsibility? A. Respect the patient's wishes and maintain confidentiality, ensuring that he receives medical care. B. Report the abuse immediately to law enforcement, even though the patient has not consented, because you are legally mandated to do so. C. Encourage the patient to talk more about the abuse and promise that no one will be told about it without his consent. D. Focus on providing physical care and tell the patient that he can decide what after treatment. Answer: B. Report the abuse immediately to law enforcement, even though the patient has not consented, because you are legally mandated to do so. Explanation: In cases of suspected child abuse, forensic nurses have a legal and ethical obligation to report the situation to law enforcement or child protective services, even if the patient does not consent. Failure to report could result in further harm. Respecting confidentiality is important, but legal requirements override confidentiality in cases of abuse. C. Encouraging the patient to talk more is fine, but promising not to tell anyone would be unethical and against the nurse's obligations. D. Focusing only on physical care is important, but the legal duty to report takes precedence over the patient's desire for autonomy in this case. Question 20. Preserving evidence in sexual assault cases. You are collecting forensic evidence from a 22-year-old woman who has been sexually assaulted. During the examination, you collect vaginal swabs, pubic hair samples, and fingernail scrapings. What should you do to ensure that the evidence is preserved properly for future legal proceedings? A. Place all evidence in separate, clearly labeled containers and ensure that it is stored in a secure location until law enforcement arrives. B. Store all the evidence in a shared container to avoid confusion and minimize the risk of losing any samples. C. Dispose of any non-biological evidence, such as clothing, to reduce the risk of contamination. D. Document the evidence and hand it directly to the patient so they can decide what to do. Answer: A. Place all evidence in separate, clearly labeled containers and ensure that it is stored in a secure location until law enforcement arrives. Explanation: To preserve the integrity of the evidence, it must be carefully labeled, separated, and securely stored according to proper chain of custody procedures. B. Storing evidence together could result in cross-contamination or mix-up of samples, rendering them inadmissible. C. Disposing of non-biological evidence could lead to the loss of critical items that might be relevant to the case. D. Handing evidence directly to the patient is not appropriate. The evidence must be handled by professionals to preserve its legal value. Question 21. Legal documentation in forensic nursing. During a forensic examination of a 50-year-old man who was assaulted during a robbery, you document his injuries, including cuts on his arms and bruising on his torso. What is the most critical fact to ensure that your documentation will be useful in legal proceedings? A. Include as much personal commentary as possible about the situation to provide additional context. B. Ensure that your documentation is accurate, detailed, and free from personal opinions or assumptions. C. Write the report quickly, as the case may not be pursued legally. D. Focus only on documenting the physical injuries and avoid recording the patient's emotional state or history. Answer: B. Ensure that your documentation is accurate, detailed, and free from personal opinions or assumptions. Explanation: In forensic nursing, documentation must be factual, clear, and precise. Personal opinions and assumptions can undermine the credibility of the evidence and may make the documentation inadmissible in court. A. Personal commentary can jeopardize the objectivity of the documentation and its legal integrity. C. Writing quickly can lead to errors and may overlook crucial details. D. Focusing only on physical injuries neglects the importance of documenting the patient's full condition, which can provide context for the case. Question 22. Supporting victims of human trafficking. A 19-year-old woman is brought to the emergency room showing signs of physical abuse, malnutrition, and emotional trauma. She refuses to talk about her situation but mentions she has been working in a local massage parlor. As a forensic nurse, how should you approach this case? A. Immediately report her to law enforcement even though she is not providing clear details. B. Provide medical care and ensure her safety first, offering her resources and a safe space to talk when she is ready. C. Focus on treating her physical injuries and tell her that she must talk about her situation to receive further care. D. Assume that she is the victim of human trafficking based on her appearance and situation and act accordingly. Answer. B. Provide medical care and ensure her safety first, offering her resources and a safe space to talk when she is ready. Explanation. Victims of human trafficking often experience trauma that makes them reluctant to seek help. Providing immediate medical care while creating a safe, non-judgmental environment for the patient is key to helping her regain trust. A. Reporting to law enforcement immediately may not be in the patient's best interest, especially if she is not yet ready to cooperate. C. Focusing only on physical injuries neglects the emotional and psychological needs of the patient. D. Assuming the victim's status based solely on appearance can be harmful and potentially counterproductive. The victim should be given time and support to disclose her situation. Question 23. The role of the forensic nurse in death investigations. You are called to assist in the examination of a body found at a crime scene. The body shows signs of blunt force trauma to the head, and there are no immediate signs of foul play in the surroundings. What is your role in this death investigation? A. Perform the autopsy yourself to determine the cause of death. B. Collect evidence from the body, document the injuries, and assist law enforcement and the coroner in the investigation. C. Immediately call for law enforcement intervention and allow them to handle the case without your involvement. D. Focus only on identifying the victim and leave the rest of the investigation to law enforcement. Answer. B. Collect evidence from the body, document the injuries, and assist law enforcement and the coroner in the investigation. Explanation. Forensic nurses assist in collecting evidence and documenting injuries in cases of suspicious deaths. While they do not perform autopsies, they play a vital role in gathering information to help determine the cause of death and support legal proceedings. A. Performing the autopsy is not within the scope of a forensic nurse's role. This is the responsibility of the coroner or medical examiner. C. Calling law enforcement is necessary, but forensic nurses are integral to the investigation and evidence collection process. D. Focusing only on identification limits the nurse's contribution to the investigation. The nurse must document and support all aspects of the case. Question 24. Psychological impact of sexual assault on victims. You are conducting a forensic examination of a 32-year-old woman who has been sexually assaulted. During the examination, she is visibly distressed and withdraws from the process. What should you do to address her emotional and psychological needs? A. Allow her time to process her emotions, offer supportive care, and respect her need for silence while continuing the examination. B. Encourage her to speak about the assault as much as she can, as this will help her heal faster. C. Push her to talk about her emotions so she can gain clarity and move forward with the examination. D. Stop the examination if she becomes too emotional, as it may affect the quality of the forensic evidence. Answer A. Allow her time to process her emotions, offer supportive care, and respect her need for silence while continuing the examination. Explanation. Victims of sexual assault may experience a range of emotions and may need time to process their feelings. Providing a supportive, empathetic environment while allowing the patient to control the pace of the examination helps maintain trust and minimize re-traumatization. B. Encouraging her to speak is not recommended if she is not ready. Pressuring the victim could lead to further distress. C. Pushing the patient to talk can cause re-traumatization and damage the therapeutic relationship. D. Stopping the examination is not ideal unless the patient requests to stop. Providing support throughout the examination is essential. Question 25. Handling suspected substance abuse in forensic cases. A 45-year-old man presents to the emergency room with injuries consistent with a car accident. He smells strongly of alcohol and is disoriented. He appears to be confused and hesitant to answer questions about the accident. As A forensic nurse, how should you proceed? A. Ignore his state of intoxication and focus only on treating his physical injuries. B. Document the patient's alcohol use and disorientation carefully, as these factors may affect his testimony later in legal proceedings. C. Assume that his intoxication is the sole cause of the accident and proceed with the treatment without considering other factors. D. Provide medical care and then attempt to obtain a detailed history from him once he's. Answer. B. Document the patient's alcohol use and disorientation carefully, as these factors may affect his testimony later in legal proceedings. Explanation. Forensic nurses must document all relevant information, including signs of intoxication, because it may have an impact on the patient's credibility or the outcome of a legal investigation. The state of intoxication could affect the patient's memory or recollection of events, so documenting is crucial. A. Ignoring intoxication is inappropriate because it may affect the legal case and the patient's ability to provide reliable account. C. Assuming intoxication is the cause may overlook other potential factors, and making assumptions could negatively affect the investigation. D. Attempting to obtain detailed history later could lead to inaccurate information if the patient's condition changes or if critical evidence is lost. Question 26. Mr. Thomas, a 45-year-old male, arrives at the emergency department with a gunshot wound to the abdomen. He claims to have been shot during a robbery attempt. You observe signs of alcohol intoxication, and he is unable to provide clear information regarding the circumstances. As a forensic nurse, what should your first priority be in this case? A. Initiate immediate treatment and stabilize his condition before gathering any information. B. Secure the scene, document the injury, and collect evidence while ensuring patient care. C. Focus solely on the patient's history of alcohol use and avoid medical interventions. D. Treat the gunshot wound as self-inflicted injury and proceed with psychological evaluation. Answer. B. Secure the scene, document the injury, and collect evidence while ensuring patient care. Explanation. In forensic nursing, securing the scene and collecting evidence is essential, as it can be vital for future legal proceedings. Despite the patient's intoxication and confusion, it is critical to document injuries, any potential signs of trauma, and secure evidence such as gunshot residue or blood for further analysis. A. Treatment is crucial, but it should not come before securing the scene and documenting potential evidence. C. Focusing only on alcohol use may compromise the proper collection of forensic evidence. D. Assuming self-infliction without further investigation could compromise the integrity of the investigation and may lead to overlooking critical evidence. Question 27. A 10-year-old girl presents to the clinic with signs of severe physical and sexual abuse. She is reluctant to speak but has visible bruises, and physical findings suggest a history of ongoing abuse. How should you approach this case as a forensic nurse? A. Immediately inform law enforcement without considering the child's mental state or privacy. B. Perform thorough physical examination and forensic evidence collection while ensuring the child's privacy and comfort. C. Avoid any forensic examination and refer the case to child psychologist for further assessment. D. Speak to the child alone, press for details about the abuse, and document the conversation verbatim. Answer. B. Perform a thorough physical examination and forensic evidence collection while ensuring the child's privacy and comfort. Explanation. Forensic nurses must approach cases of child abuse with sensitivity, ensuring the child's emotional and psychological well-being while collecting essential forensic evidence. It's critical to provide safe, trauma-informed environment for the child to participate in the examination without coercion. A. Informing law enforcement is important, but the child's immediate needs and privacy should come first. C. Referring solely to child psychologist without conducting forensic exam could delay critical evidence collection. D. Pressing the child for details could re-traumatize the victim and hinder reliable voluntary report. Question 28. During an autopsy, you observe signs of blunt force trauma on the body, and there is evidence of possible strangulation. The pathologist suggests the cause of death could have been a combination of factors. As a forensic nurse, what should be your role in this investigation? A. Provide the pathologist with detailed medical history information, but refrain from offering an opinion on the cause of death. B. Analyze the body's wounds in detail, make assumptions about the cause of death, and report findings directly to law enforcement. C. Focus solely on documenting the wounds and allow the pathologist to conclude the cause of death without providing any additional information. D. Work with the pathologist and law enforcement. Document the wounds, the context of the injuries, and any potential signs of foul play. Answer: D. Work with the pathologist and law enforcement to document the wounds, the context of the injuries, and any potential signs of foul play. Explanation: Forensic nurses play a critical role in providing thorough documentation of injuries and any potential signs of foul play that could contribute to the determination of cause of death. Collaborative work with the pathologist and law enforcement is essential in complex cases like this. A. Refraining from offering an opinion is appropriate, but forensic nurses are expected to document all findings relevant to the case. B. Making assumptions without proper evidence could lead to inaccurate conclusions and may harm the integrity of the investigation. C. Limiting involvement only to documentation without considering the broader investigative context would undermine the thoroughness of the case. Question 29. In a case of suspected drug-facilitated sexual assault, you are preparing to collect evidence from a female patient. The patient reports having been in an unconscious state for several hours but is now awake and alert. What should be your next step as a forensic nurse? A. Collect all evidence, including toxicology samples, as soon as possible to minimize contamination. B. Wait until the patient is fully rested before starting the collection process to ensure accurate results. C. Focus on gathering a detailed verbal account of the patient's experience before any physical examination is done. D. Collect evidence only if the patient explicitly consents, as the situation might involve complex psychological factors. Answer A. Collect all evidence, including toxicology samples, as soon as possible to minimize contamination. Explanation: In suspected drug-facilitated sexual assault cases, collecting evidence, particularly toxicology specimens, as soon as possible is critical for the investigation. Delaying evidence collection may lead to the degradation or loss of crucial information. B. Waiting for the patient to rest could jeopardize evidence collection of toxicology samples, which degrade over time. C. Gathering a verbal account is important, but it should not delay evidence collection, as timely specimens may be essential for detecting drugs in the system. D. Evidence collection should proceed regardless of explicit consent at the time of examination, as the victim may be under the influence or confused, and consent is a complicated issue in forensic cases. Question 30. A forensic nurse is assigned to investigate a potential case of domestic violence. The patient, a 32-year-old female, is presenting with severe bruising, broken ribs, and signs of a concussion. She is unwilling to provide specific details and is fearful of her partner. What is the most appropriate course of action for the nurse? A. Focus on immediate treatment, ensuring the patient's physical safety, and provide emotional support before discussing the abuse further. B. Attempt to gather a detailed history of the abuse from the patient as soon as possible to ensure a legal case can be built. C. Call law enforcement immediately to report the abuse and let them handle the investigation. D. Take a neutral stance, treating the injuries without delving into the patient's situation, and refer her to another professional for further help. Answer A. Focus on immediate treatment, ensuring the patient's physical safety, and provide emotional support before discussing the abuse further. Explanation: the immediate safety and well-being of the patient are the priority. Providing emotional support, ensuring that the patient is stable, and addressing her injuries first will build trust, which may lead to a more effective discussion about the abuse in the future. B. Attempting to gather details immediately cause further distress and is not appropriate at the first point of contact. C. Calling law enforcement is necessary, but it should not take precedence over the patient's immediate care and psychological safety. D. Taking neutral stance might prevent the nurse from engaging with the patient on deeper level and could undermine the quality of care and emotional support.